The teenager Elliott Holmes took his own life. His family made it their mission to support others struggling with their mental health. They set about raising money so other young people in the Gravesham area could access private mental health counselling. 5 years on, they've helped more than 370 people, and there are hopes their approach can be used elsewhere. Ellie has our story update.
Elliott Holmes was just 19 years old when he took his own life after failing to access the support he needed for mental health issues. Since his death, his mother and stepfather have made sure young people in Gravesham have access to free counselling when they need it. So far, they've helped almost 400 people.
Males are statistically 3 times more likely to take their own life, yet far less likely to come forward for help. With our model, we've seen a rise from 21% of all referrals being male up to 43%, a significant increase, and this is a huge leap in suicide prevention.
If we can help save another young life, that's what we keep doing in Elliott's memory, and I know he'd be very proud.
The Elliott Holmes Memorial Fund relies on donations, with local businesses, parents and school children helping to raise around £200,000 since it was set up 5 years ago.
I think, especially at school, you get caught up in a bit of a frenzy occasionally. I think, obviously, we're coming up towards A-levels now, GCSEs, anything for young students, especially sort of young men coming up through the school, they often don't speak about it. And it's whether it's like an embarrassment or sort of a self-pride thing, and I think it's been a problem for a while now. And sort of the charity gives direct counselling without waiting times, which is also a problem. And it helps to tackle that stigma with the self-referrals and everything. It just allows young men to sort of confront their problems and helps them to solve that.
NHS guidelines aim to offer mental health treatment to young people within 18 weeks of a referral. But one recent national study put the average wait after being referred to mental health services last year at 392 days. With numbers of young people being referred rising by more than half that same year compared to the previous 12 months.
Waiting on endless waiting lists has a hugely detrimental impact on young people, and we know this. By the direct action to picking up the phone and being able to speak to a trained counsellor to help work through those niggles and those problems are so incredibly crucial and I think fundamental.
The NHS in Kent says more mental health teams are being made accessible for young people, but acknowledge there's still more to do. With support from their local MP, Kerry and Peter say they're determined to show government how Elliott's legacy can help young people across the country. Ellie, BBC South East Today.
And a reminder, if you've been affected by the issues raised in Ellie's report, you can find support at bbc.co.uk/actionline.